The HMPV pneumonia virus spreading in China has raised concerns worldwide. This virus shares similarities with the coronavirus, particularly in terms of symptoms. The increasing number of HMPV infections has caused worry due to its resemblance to influenza and cold symptoms. The virus's similarity to COVID-19 also evokes fears of a potential epidemic. As HMPV cases rise, it's important to understand its characteristics and how it compares to other respiratory illnesses. The infection causes cold-like symptoms, including a runny nose, cough, sore throat, and fever. In some cases, it can lead to severe lower respiratory infections like pneumonia and bronchitis. HMPV typically spreads during the winter and early spring months. It primarily affects young children, older adults, and those with weakened immune systems. The virus was first identified in the Netherlands in 2001, although it is believed to have been circulating before that time. It can affect individuals of all ages, but it poses a greater risk to certain groups. These include young children, the elderly, individuals with weakened immune systems, and those with chronic respiratory conditions like asthma. Because of its impact on vulnerable populations, the virus is closely monitored during peak seasons. Early detection and preventive measures are key to limiting its spread. The virus spreads through respiratory droplets produced when an infected person coughs or sneezes, or by touching surfaces contaminated with the virus. While experts indicate that it is not currently a global threat, understanding its symptoms and prevention methods is essential to minimize its spread. Preventative measures are similar to those used for cold and flu prevention. These include washing hands thoroughly for at least 20 seconds, avoiding touching the eyes, mouth, and nose with unwashed hands, and covering the nose and mouth when coughing or sneezing. Additionally, wearing a mask in crowded places can help prevent transmission. Regularly disinfecting frequently touched surfaces is also a key precaution. Staying home when feeling unwell and seeking medical advice if symptoms develop can further reduce the risk. Public health awareness campaigns play a crucial role in limiting the spread of the virus. The respiratory system is highly vulnerable to viral infections, with several viruses causing severe illness and even death. Among the most dangerous are the influenza virus, known for causing seasonal flu epidemics, and the respiratory syncytial virus, RSV, which leads to serious respiratory illness, particularly in infants and the elderly. The novel coronavirus, SARS-CoV-2, has caused the global COVID-19 pandemic, leading to millions of deaths and overwhelming healthcare systems. Another significant threat is the human parainfluenza virus, which can lead to conditions like croup and pneumonia in young children. Adenoviruses are also concerning, capable of causing a wide range of respiratory illnesses. The H1N1 influenza virus, also known as swine flu, had a global impact in 2009, while the MERS-CoV virus, related to SARS, caused high mortality rates. The Epstein-Barr virus, typically associated with mononucleosis, can also lead to serious respiratory complications in some cases. Lastly, the varicella-zoster virus, causing chickenpox, can lead to pneumonia in immunocompromised individuals. These viruses vary in their impact, but all pose significant risks to the respiratory system, especially in vulnerable populations. Prevention through vaccination and hygiene practices remains essential in reducing the spread and impact of these viruses.